Welcome to Week 4 presentation, Neoplasms. This is Dr. Regina Glenn, and I will be hosting this presentation. All neoplasms are classified in this chapter, whether they are functionally active or not. An additional code may be used to identify functional activity associated with any neoplasm. Malignant neoplasms are cancerous tumors, which grow rapidly, spread, and can be life-threatening. Benign neoplasms are non-cancerous tumors, which grow slowly and are encapsulated. Malignant tumors are cancer cells that interfere with normal growth. Some types of malignant tumors include cancer, carcinoma, lymphoma, leukemia, melanoma, and sarcoma. Some types of benign tumors include lipoma, hemangioma, osteoma, fibroma, neuroma, and fibroid. In order to code a neoplasm, first determine the type of neoplasm. Codes are located by the name of the neoplasm. Reference the neoplasm table. The neoplasm table is arranged alphabetically by anatomical structure. Next, choose a column based on type and identify the code. Columns on the neoplasm table denote the category of the tumor type. These include malignant primary, malignant secondary, carcinoma in situ, uncertain behavior, and unspecified nature. Some guidelines to follow are if the documentation state metastatic from, this is a primary site. For example, bone ments from the breast. The breast would be the primary site and the bone would be the secondary site. Metastatic to means this is a secondary site. For example, sigmoid cancer with mets to the liver. Here, the sigmoid is primary and the liver is secondary. If only one site is given, it is usually a primary site, unless the documentation states metastatic or mets. This indicates a secondary site. If no additional information is listed in the diagnoses, the coder may have to query the physician to determine if the site is primary or secondary. However, here are some common primary sites: the breast, esophagus, stomach, small and large intestine, genital urinary organs, and respiratory tract organs. Common secondary sites include the liver, lymph nodes, and bone. To determine if the neoplasm should be listed as the primary diagnosis, determine if the focus of the visit was at the neoplasm. If the focus is on an acute or chronic condition, this becomes the principal diagnosis. It is possible for a patient to have two primary sites. Determine where the treatment is directed. This is the primary neoplasm that should be listed as the principal diagnosis. If both sites are treated, either site can be designated as the principal diagnosis. When a patient has both primary and secondary malignancies, determine the focus of treatment. If the treatment is only for the primary site should be the principal diagnosis. When the treatment is only for the secondary site would be the principal diagnosis, and the primary site should be listed as a secondary diagnosis. When the treatment is focused at both the primary and secondary site, either may be listed as the principal diagnosis. When the treatment is focused at a secondary site because the primary site has been excised, The principal diagnosis is the secondary site, and a history of neoplasm code is assigned as the secondary code for the primary site. Cancer patients have routine follow-up exams following eradication of the cancer. These should be coded according to the status of the patient. The neoplasm is coded using the neoplasms code as long as it is under treatment. Once treatment has ended, or if the neoplasm has been eradicated, then the neoplasms is coded using a history code. If a neoplasm reoccurs, it is coded as a primary neoplasm. There are several different complications that can be associated with neoplasms. These are anemia, dehydration, complications of surgery, and pain. Code each of these according to the complication. Watch for combination codes that include the neoplasm and the complication. Therapy for neoplasms may also cause complications. Some of the more common complications due to therapy are nausea, vomiting, and dehydration. This is the end of the presentation on neoplasms. If you have any questions, please contact your instructor.